I hope the day will be a lighter highway, for friends are found on every road. I exercised every day. I did breast self-exams regularly, and I went to mammograms every year. I was feeling great. And out of the blue, I got a severe stomach reaction of something. I had 4 days of every test imaginable. And at the end, the doctor came in and told me I had stage 4 metastatic breast cancer. During the first appointment, the oncologist told me that I had about 2 years to live. And then she told me I should quit my job, do my bucket list, spend time with my loved ones. She said I was not a candidate for clinical trials. Talked to my family. My sister-in-law, Janet, said, we are getting you a new oncologist. And she determined that the Lombardi Cancer Center at Georgetown was absolutely the best place to be.
So when I first met Lena, there was a whole new class of drugs that was being evaluated in hormone receptor positive breast cancer, which is a subtype that Lena has.
So 2 days later, I had an appointment with Dr. Isaacs, and she told me there were many treatments for the kind of cancer I had, and that indeed I was the perfect candidate for a new clinical trial that was starting in a couple of weeks.
We look at the patient as an individual at Lombardi. With Lena's incredible energy and spirit, we wanted her to live life to the fullest for as long as she possibly could.
I will never forget, she looked me in the eye and she said, you are going to do really well. And at that moment, everything changed. I was given hope, and I was given my future back.
Through clinical trials and through trials that we can offer at Lombardi, we are having new drug discoveries come into the clinic at a really rapid pace in breast cancer, and that has really changed the outlook for patients.
That was exactly 5 years ago, and I have to tell you, I've had the best 5 years in my life, hands down. I have to go every month to my appointments, and I really look forward to them because I love them so much. We're hugs and kisses, and they are so much part of my life. They're family to me now.
What we are all striving for is to improve the outcome of women with metastatic breast cancer and to allow them to have their own individual, whatever it means to them, to have their spirit of life. And I think Lena is an incredible example of that to all of us. I strive to have her spirit.
Hope is out there, especially at the Lombardi Center. When you're given a grim diagnosis, everything becomes amplified. But if you have hope, everything becomes amplified, but in a really positive way. Every day is a gift, every moment matters, and gratitude becomes a way of life. If your